Welcome to the Whole Person Care for Infants to Adolescents, Building a Foundation for Lifelong Health webinar. My name is Emily Noodleman, and I'm the Director of Implementation and Outreach at the Bree Collaborative. This webinar is co-hosted between the Bree Collaborative, the Foundation for Healthcare Quality, Comagine Health, and the Washington Health Alliance. We're excited to have each of you join us today for the first webinar as part of a three-part series on catalysts for change across the lifespan. Before we jump in, I just would like to review some items with you. You have all been placed on mute upon entering the webinar. Please write any questions you may have for our presenters in the Q&A box at the bottom of your screen. We will not be calling on individuals to verbally pose their questions or comments to our speakers, but our staff will be reviewing the questions in the Q&A box and will be asking them on your behalf. The webinar today will be recorded, and we plan to send out a PDF of our slide deck and the recording to all of you who signed up to attend today. And we'll post the recording on the Bree Collaborative's website. For our agenda, we'll start with some introductions from our host organizations, have a presentation from our speakers. After each presentation, we will ask them one quick question about their material, and then we'll open up to more of a large group discussion and facilitate with more questions from all of you that we have for them. And then we'll work on wrapping up the event. So we just kind of want to ground each other first on what is whole person care. And whole person care is an approach that looks at an individual as a whole, considering all the aspects that make them who they are. It focuses on understanding of how these elements, such as biological, behavioral, social, and environmental, intersect and interact with each other. This perspective encourages us to view the person beyond their condition, considering the multiple factors that contribute to their health or well-being. According to the NIH, whole person care involves empowering individuals, families, communities, and populations to improve their health across interconnected biological, behavioral, social, environmental domains, rather than simply treating a specific disease. This approach really emphasizes restoring health, promoting resilience, and preventing illness throughout a person's lifespan. In this series, we will explore the essential role of whole person care in promoting health and well-being at every life stage, youth, adult, and older adult. But again, today's webinar will focus specifically on the health of infants through adolescence. We'll examine the physical, behavioral, social, environmental factors that shape the health of this age group. And throughout the session, expert speakers from various sectors of the healthcare ecosystem will share their strategies, perspectives, and ongoing efforts to support whole person health for young people. I want to invite and just take a moment to invite Jeannie Weir, Drew Oliveira, and Dave Ross Ford to share work on their organizations are doing on health equity. First, I'll invite Jeannie.
Thanks, Emily. And good afternoon, everyone. I am Ginny Weir. I am lucky to be the CEO of the Foundation for Healthcare Quality. And we are a neutral nonprofit organization whose mission is to catalyze system-wide quality improvement by getting together all of those who give, get, and pay for care and letting them lead the way within a framework driven by meaningful clinical data, collaboration, and evidence. I love that our Catalyst for Change series is framed around this life course perspective. My background's in public health, and I love to kind of bring that framework to the forefront whenever we can. I'm also the mother of a 3-year-old and a 6-year-old, so this feels very real to me, both personally and professionally. Our foundation is home to the Bree Collaborative, as Emily said, this public-private group that works to develop and implement clinical guidelines for high-priority healthcare services. We were lucky to spend all of 2024 developing and refining our guidelines on youth behavioral health. And so after this webinar, I encourage all of you, and we'll put a link in the chat for you, to look at how we really envision the healthcare system working together to make sure that all of our kids are healthy and happy. And Drew Oliveira, I will turn it over to you.
Thanks, Ginny. Hi, I'm Drew Oliveira. I'm the Executive Director of the Washington Health Alliance. We are an independent nonprofit focused on equitable access, quality, and affordability within the marketplace. We are an organization that is essentially supported by our membership, and our members are driven by the purchasing members primarily, but we also have health plans, provider organization, as well as others interested in the healthcare ecosystem. And we host the Washington Community Checkup, which is soon to be released. for the current year, looking at quality, equity, and affordability by medical groups, counties, accountable communities of health, et cetera. We also take on special projects. So this is pretty important to us because we almost always have a behavioral health project ongoing. Our current one is really looking at behavioral health outcomes. And I don't think we can, really talk about anything related to healthcare if we're not really taking that whole person into account, and certainly the impact of on children in terms of resiliency and support, and really getting people to the right care at the right time when they need it, I think is really important. So I'm very interested in our speakers today, and I think that'll be this will be a fantastic discussion and good kickoff for our series. And I'll pass it over to Dave.
Thanks so much, Dave Ross, representing Comagine Health, and we're happy to be invited here today and to participate and partner in this work. If you're not familiar, Comagine Health is a national nonprofit healthcare quality improvement organization. We leverage data and expertise to help federal and state governments, healthcare organizations, communities help improve outcomes, enhance patient and provider experience, and lower costs when possible. It's similar to Jenny. I'm in the thick of this period of time in lifespan. I have a 16-year-old, a 13-year-old, and an 8-year-old. So it's important to me. I also spent 10 years of my career in public health and population health, working in pediatrics, quality improvement specifically. So I've done a lot in this space. And as an organization, we're absolutely committed to whole person care for this age group, and have numerous projects that span from topic areas like follow-up to social emotional screening, including suicide prevention, and also substance use disorder work with adolescents. So we do a lot of work in this space. What does that mean to us in terms of how we approach this work? And I would note two kind of buckets. One is in the quality improvement space, we do a lot to tailor our approaches. This is an interesting part of lifespan. How you approach a project for infants is really family-centered and dyadic, at least in terms of parent relationships. But as you get into adolescence, there's obviously the transition to more autonomy and participation in their own healthcare and healthcare decisions. So tailored approaches are important. Patient and family engagement is at the center of what we do. Nothing about me without me. So if you're doing a project with teens, you should involve teens in planning your quality improvement effort. And also a big community focus. Health extends beyond traditional medical settings. So we always try and incorporate community-based approaches and engage in key partners such as early learning, social service agencies, faith-based organizations, always asking where are the cars or car seats parked for this population. The other big bucket is really around data integration and sharing, and it's important that we build trust in infrastructure. Data moves at the speed of trust, so investing in those opportunities is important because you need those relationships to share data. Interoperable technology, if you're engaging with community-based organizations and traditional healthcare facilities, the interoperability is really important. So that's always an area of focus that we bring. And then lastly, I just note the importance of empowering patients through consent, and that whenever you're using or sharing data, that's a transparent process. And obviously that gets tricky as you start talking about adolescents, but it makes it all the more important. So just wanted to share a few ways that we focus on this work. By kind of doing this in this interconnected way, we strive to facilitate comprehensive whole person improvements for this age group. So thanks again for the opportunity to support this work and be here, and I'll pass back to you, Emily.
Thanks, Dave. So now we'll transition and hear from our speakers. We just want to take a moment and introduce them to you. We have Libby Hein, the Director of Behavioral Health at Molina Healthcare, Dr. Andrea Donalty, the Medical Director of Primary Care Network at Maricruz Children's Hospital and Health Network. We have Maricruz Sanchez, the Interim Director of Coordinated Access from WithinReach that we'll get to hear from today. I will welcome Libby forward to learn more about what they're all doing at Molina and how a health plan can really support whole person care and behavioral health for this population.
Yeah, thank you so much, and good afternoon, everyone. I'm really excited to be a participant on this webinar, and it really is an honor to be presenting along with such amazing and dedicated folks, all working to improve the lives of youth within Washington State. I'm Libby Hein. I'm the Director of Behavioral Health. I'm a licensed mental health therapist. with a specialty around child and family. So all of my career really has been focusing on family and children. I focused within Medicaid system in the last 7 years within Molina Healthcare. And prior to that, I was outside of the Medicaid system in the nonprofit, where I also dabbled a little bit in early learning and basic resources, home and community, family support programs and foster care programs. All of these work together all the time to really improve the health and mental health and physical health for children in Washington State. Next slide, please. So just a little information about Molina Healthcare. We are the largest Medicaid plan within Washington State. We are in our 25th year here in Washington State, so very excited about that. We provide services to anyone who qualifies and chooses our plan. And most of our members are children and families. Matter of fact, 1 in 4 children in Washington State are covered by Molina. So we have a vested interest in this. We really want to ensure that children are getting the health care that they need, whether it be physical or behavioral. Next slide, please. So when I tell people I work in managed care, I hear, oh, you're an insurance company. And I always kind of chuckle at that because that's actually what I thought prior to working with managed care. But really, managed care is really about improving the health of our members. And we do that in a variety of ways. I mean, some of them were discussed earlier. We leverage a lot of technology and really looking at data. So, we started integrated managed care, which means bringing physical health and behavioral health care together here in Washington State back in around 2016. I should know that for sure, but I think it's around 2016. And then we had the COVID pandemic in 2020. And so our data has been really difficult to really pull together to see what is happening for youth across Washington, in both physical health and behavioral health. But we now can do that. We have enough data, we have time. And so we're starting to look at things like, what is going on with our youth in Washington State? Are they getting into behavioral health care in different regions? We can look by region, we can look by age, we can look by ethnicity. It starts to put together a picture of where we're seeing trends, where we have some challenges, and how we can really improve the healthcare within Washington. We also, at the same time, have HEDIS measures. I mean, most people are pretty familiar with HEDIS measures, but they basically are measurements that are standardized measurements that really can look at specific things, such as did a child receive a well child visit with a primary care physician within the last year? And all of this, we also work in collaboration with other systems of care. We're identifying sometimes challenges when we work with children that are with DDA or children that are with DSHS or children that are in foster care. So we can really look across systems and with partners to really determine what's going on and then use our data to really take a deeper dive to see what can we learn about what's happening and how can we really work to improve that. And then, as indicated earlier, really make sure that we are involving people who are experiencing the services in understanding more what's happening. We also, when we look at things, we can look at enhancing care coordination. I think that's one of the things that we are really focused on across Washington State and all different systems of care. At Molina in particular, we're very focused on ensuring that transition age youth are getting care coordination, folks who are struggling with substance use disorders, and youth who are at risk for going into inpatient or are frequently accessing the emergency room departments. We're constantly trying to ensure that they get the services that they need and that we work with those children and families to ensure that they can get connected into care. Next slide, please. So now I really want to share with you kind of a way that this really works in practice. This is an example of a partnership between Molina, the Healthcare Authority, and one of our innovative partners, Excelsior Wellness. Virtual intensive engagement wraparound services, VIEW we call it, was developed in response to several key identified areas that were really happening in Washington State back in 2022. So one of those areas is we were really looking at the need for rapid access to comprehensive care services for youth and families, particularly in the wake of the COVID pandemic. Children and families were struggling. Children were not in school, families were unable to work. There were a lot of factors going on you're all very aware of. And we really thought we really have to figure out how we can address this and really ensure that youth are getting the care that they need. At the same time, our data indicated that several youth were struggling in some regions to get into what's called wraparound with intensive services. And that is what most people know as WISE within Washington State. It's called the WISE program. And even though providers in certain regions were doing their best, they were working as hard as they could to increase access. Outpatient providers were pitching in, everybody was coming together. There was a limited workforce, and WISE providers were struggling with recruiting and retaining staff during this time. And so we had children who were in need of services who were not getting the services that they needed, and everybody was incredibly concerned about this. In addition, behavioral health services changed. After COVID, everything went, to telehealth for a while. We had some telehealth going on within the field, but never to the extent that we did before. And this really opened up a new way of really looking at doing services. And it provided an opportunity to really look at, when we used to look at access, we'd look in a region and we'd say, oh, in this community, we need to build more of this service. And so we would focus on doing that within the community. Now we could look at it from a picture of looking across the state and saying, well, in WISE, if we have over here in this region, we have an access challenge that we're addressing, and we're struggling with workforce, but we have another region that actually has access. How can we utilize that region to support the whole? And I think that's happened across many different areas, including physical health with telehealth expansion. During the same time, we were in discussion with Excelsior. Excelsior had approached us and said, hey, they were a WISE provider and they love doing WISE. And they said, we're doing this kind of new stuff and we're wondering if there's an opportunity to do some expansion. They really they're focusing on integrating primary care into their services there and have integrated primary care into their services. They also wanted to do more substance use with children. And then they were really working on really innovative ways of engaging youth into virtual services by using some gaming technology. And it's so far out of my realm, but they were doing some incredible things that were really engaging youth into telehealth services in a very different way. So we had discussions with the Healthcare Authority and Excelsior and Molina. We all came together and said, is there some opportunity here? And out of that view was born. The results have been incredible. This started in late October 2022. For the first 3 months of implementation, we saw a decrease of youth on the WISE interest list by 121 youth. And that's incredible, right away impacted. Since its inception, it has served over 275 children. Most often, they're able to get children in within 48 hours, which is incredible. We know that is so important for youth to get them into services as soon as they need it, because the longer that we wait, the more likely they are to need crisis services and other higher levels of care. And that is incredibly disruptive for families when they go into that kind of a crisis level. We also saw improvement in health outcomes. So looking at decreases in GAD scores of around 4 points. Really looking at a decrease in the PHQ-9 from about 8. And other things that were kind of unusual that came out of this. One area that was really unusual is they found that they were able to support families who had children who were neurodiverse. in a new way. And that was really helping to support some of the families that were struggling pretty significantly in Washington after COVID. They also were able to improve workforce, and that was an unexpected thing. You know, it used to be that when an employee would leave the area, they would go to work somewhere else. So there would be a disruption of care for kids. And that often happens in community behavioral health. This program allowed that employee to continue to work at Excelsior, no matter where they were located, as long as they continued to meet the licensure requirements in Washington state. We saw a reduction in healthcare costs that was pretty incredible. So we 12-month pre and post intervention data showed a 35.75% decrease in emergency department utilization and a 15.75% decrease in inpatient utilization costs, really showing that we were getting kids into care quickly and effectively. This program has been so successful that we've partnered with Catholic Community Services in Western Washington to implement a similar program. It's a little different, it's hybrid, but it is providing in-person and telehealth services over in Western Washington in a new way to see kind of how that really can impact things. So thank you so much for allowing me to share this example of how managed care can really help to improve the health of youth in Washington state.
Libby, I just had a question for you. When we were speaking, we were talking about how Washington State has really taken on the initiative of working to integrate care between behavioral health and primary care. As a managed care organization, how is Molina supporting the integration of behavioral health into primary care?
Yeah, so we do that in a variety of ways, often through contracting. So, you know, we do value-based contracting that really encourages the integration of behavioral health and physical health. We've worked with a lot of providers since the implementation of integrated managed care in bringing on the other services. So physical health providers are really working to bring on behavioral health services, and behavioral health services working to integrate physical health services where it makes sense. And so it's been an incredible journey. It's a lot of consultation and a lot of working together, and really a lot of working with our system partners.
Thank you. I really appreciate that. And we'll transition to this also helps us kind of transition to our next speaker, Dr. Donalty, really showing the primary care side of things and how we're working on more the physical health and supporting whole person care in a clinic setting. So I'll pass it to her.
Great, thank you. And welcome again to everybody. I really appreciate the invitation here. And I'm also honored to be on such a great panel group today, and certainly all of us continuing to learn from each other. So as Emily said, I'm Andrea Donalty. I'm the medical director for our Maricruz owned and operated clinics. We have 5 clinics that span 3 counties. And we are continuing to grow a little bit. For those of you who are a little bit familiar with multi-care, you may know that's the larger organization. Maricruz is all things pediatrics, essentially, underneath the multi-care umbrella. Our mission for multi-care, and certainly for Maricruz as well, is partnering for healing and a healthy future. We've added the 4 children in the Maricruz realm. And as you'll hear today, and certainly learning from our other speakers as well, we all work in partnership. Many people call healthcare an ecosystem, and we certainly are, which means none of us can function without each other. You can go to the next slide. What I wanted to focus on mostly is the third point there, but we're going to talk a little bit about what primary care pediatrics is, because there's sometimes still a little confusion amongst the general population what that is, and then what happens at well child checks. Most people know what happens at sick visits, but not necessarily what the well child checks are for. And then really the main focus will be, how do we contribute to whole person care? So you can go to the next slide. This next one is not meant for you to be able to read any of it, but simply to show how much happens at preventative health visits. So this is the roadmap from Bright Futures, which is put out by the American Academy of Pediatrics, so our governing organization. And if you were to look at any of the details on there, you would see there's various age groups and then dots or stars for, what we should do or what's a screening or what's recommended. So I wanted to put that on there just to show how much we need to do at these well child visits. You can go to the next one. The American Academy of Pediatrics also has a policy statement that gets revised every couple of years. So the most recent one was published in February of 2022. That covers a little bit of definitions and what we are supposed to do. What is pediatric primary health care, and what's the role of the pediatrician in that? So just a brief overview on, and again, that's not meant for you to read all the words, but just to show that there's a lot that we encompass in primary care. So pediatricians have completed 4 years, so post undergrad education, there's 4 years of medical school and then 3 years of intensive training that's devoted solely to the care of the child. And that's infants, children, adolescents, and into just early young adulthood. Typically, by the time this training is done, there's been about 15,000 or more hours of training, 5 different levels of testing, several of which involve 2 8-hour days of testing. And then there's maintenance of certification to provide lifelong learning. This is why pediatricians are uniquely poised to take care of children. There are other levels of care that is done in pediatric primary care by other types of clinicians, but the American Academy of Pediatrics advocates having the medical home led by the pediatrician because of this background. If you go to the next slide, in primary care pediatrics, we focus on the health of the child, as well as anticipatory guidance for the child and the family. Obviously, all of this is age appropriate depending on the age of the child and what level of involvement they have. We look at their physical growth, we look at their psychosocial growth and development, there's screenings done at various time points. We certainly do diagnose and treat acute and chronic disorders, but much of what we do is longitudinal. So developing a relationship with your primary care pediatrician or APP is important so that when different things come up along the way, whether that's chronic, whether that's acute, whether it's some of the things we'll talk about in the main part of my my message to you, having that relationship is important. And then certainly if there's more complex conditions, because we are primary care, we're not specialists in various areas. If there's anything that's more complex, we help in maintaining that coordinated management. And in a moment, I'll talk about the medical home versus what's called the neighborhood sometimes as well. So we're a little bit more of that coordinating force for all of that. If you go to the next slide, what we do also is very family-centered. So the child obviously isn't living by themselves. They're not their own entity. As they become young adults, we encourage and support that as well. But we are part of a social network, regardless of the age that we are. So our families, our friends, our neighborhoods, our workplace eventually, all of that. And so we keep that care very family-centered and focused on the family. We will look at community resources, what the strengths are of the family, where their needs might be. We certainly want to be aware of cultural sensitivities, and I'll talk about that on the very final slide as well. If you've ever heard the term medical home, you may be familiar with this. If you haven't, that started in pediatrics way a number of decades ago, around the 1960s. And that concept was to have your primary care clinician be almost the conductor of the orchestra there, in particular with children who had special needs and who had any variety of things, whether they were neurodiverse, whether they had medical special needs, and so on. And that was meant to be that coordinated location and the hub by which the family could come to and be comfortable and know that if it wasn't something that could be provided right in that location, that would be coordinated. You go to the next slide. So we'll hone in just for a moment on a very particular part of what we do in primary care. That's certainly not everything, but a well child visit. So that starts in the outpatient world, typically when a baby is only a couple days old. So we'll see them when they come from their hospital discharge, or if they had a different type of birth presentation, wherever that was, we'll see them there. And then from there, there's a recommended schedule from the American Academy of Pediatrics that ultimately then becomes an annual visit. At those visits, we look very much at the growth and development. And again, that's not only the physical portion, but as children get a little bit older, we're also looking at their mental and emotional health. Before we're looking at their own necessarily, we are actually looking at that of the family. An example of that is a screening tool that we use, the Edinburgh Postpartum Depression Screen. So that is offered to families when they come in, when the baby is only a few days old, at their 2-week visit, at their 2-month visit, at their 4-month. Because again, in this whole person, which includes the family, if let's say we have a mom who's suffering from significant postpartum depression, well, that affects the health of the baby as well. So that's what I mean by, looking at all of that. You can read a couple of the other things that we do there as well. And we do incorporate social determinants of health. So my final slide will have a little bit of that on there as well. In this particular one, for a well child visit, I do want to emphasize that we provide a comprehensive visit. Many, many times we get a request for discussion or questions on the sports physical. So I did want to call that one out in particular. When we do an adolescent visit, what happens for a sports physical already happens in that comprehensive visit. And that's why most pediatricians feel fairly strongly that these visits in the most ideal setting happen in the medical home. A sports physical is a small portion of that visit. It's looking over some screening questions to identify whether or not there are risk factors in the patient themselves or in their family that might put them at risk if they participate in sports and if they need some additional specialty evaluation. And then a short exam. That's all that is. What we do and what happens in a comprehensive adolescent visit is certainly that, but more. We are administering, what you heard about the PHQ-9 and the GAD-7. We do that with all of our patients, 12 and up. We talk about those social determinants of health. We talk about adverse child events, if there are any. Depending on the age of the child, we may speak with them alone and see if there's anything that they want to talk about. The sex, drugs, and rock and roll conversation from a number of decades ago has expanded a little bit now, right? We get into social media and all the implications there. We look at their vaccination status, and the list goes on. And so that's why we encourage our patients who are wanting to participate in sports to come just see us for the well child visit, because they'll walk out the door with their sports physical paperwork signed, but they also get so much more. This is also why we feel very strongly about, again, I mentioned the medical home many times, doing this in that setting versus just episodic care. So retail-based health or urgent cares or things like that, we partner with as well. We've got urgent cares in Marybridge also. Those are great for acute things that maybe you can't get into your regular office for, or it's after hours or things like that. But what we're talking about today in that whole person care really, really should happen in the most ideal setting in that medical home. So let's go to the final slide. Which is what I really wanted to focus on, and how do we deliver that whole person care? Well, I think everybody on this call probably knows what some of the social determinants of health are. We have paid attention to the health literacy of our patients. That varies in all of our clinics. Some people are very health literate, others need that guidance and coaching with that. Access to care, insurance. So in some of our locations, we are one of very, very few that take Medicaid. Sometimes that's tough for people who have that as their carrier to be able to find care. So we are committed to serving the community that we're in. The neighborhoods that people live in, whether they have housing, access to food. When we're talking about some of the anticipatory guidance, we can't just say, hey, I think your child should be outside playing. It's good for them for these reasons. Maybe they don't have a safe place to go. Maybe they live in an apartment building and it's not that easy, because somebody has to be down watching the child, again, depending on the age of the child and things like that. So those are things that we incorporate into our conversation. The adverse childhood events that I was talking about, we actually have a screening for that to ask about some specific things. But we also look at the opposite. There's a little bit more discussion now in the general public too about PCEs, not just the ACEs, which is protective childhood events. Some of these adverse things will happen. Some, the children can't choose, what environment they're going to be in, but we can help find those protective events and help with that resilience of the family and the child as well. We are pediatricians, we're not social workers, but we do have a whole team that looks at the whole person and the whole family. Hence my reference many times to the medical home and the medical neighborhood. So what we mean by the neighborhood, and Marybridge is a great example of that, is we've got almost all the pediatric specialties. We're missing dermatology, so that would be great to have. But we do have partnerships out there as well. So if we need one of those specialists, they're part of our team. And while that's not happening in our primary care medical home, that's part of Marybridge, so hence the neighborhood concept. The previous presentation concluded with the question about incorporating mental health. So we don't have this yet fully functional in all 5 of our clinics, but we've got 4 of 5. We've got embedded mental health therapists, and we work in the collaborative care model there. So right alongside of us, we've got therapists that we can refer our patients to. We can do a warm handoff. Collaborative care is a whole other talk, and there are some parameters around that, so that's not the right solution for everybody, but that does help the majority of our patients who need some mental health. We partner together with many of the other community services. So just a quick anecdotal example, this patient now is well into toddlerhood, but it was a patient of mine, and it was a single mom, first child, and she needed a lot of support, had a lot of wonderful questions about her baby's care. So our nurse was able to help her with a lot of those. We scheduled her such that she would feel that extra support there. And we also got her in touch with the county public health nurse, because that had not been identified during her pregnancy, that she was eligible for that. And so together, we kind of surrounded her with the supports that were comfortable for her and that she needed. And I say comfortable for her because sometimes there are a lot of supports out there, and maybe families don't necessarily want that, which leads into that culturally aware care as well. So not only language, we do actually have language services as well. And across our clinics, we pretty consistently have over 20 languages that we provide care in through our language services. The other thing I wanted to mention on culture is things that we don't necessarily think about nowadays for culture, but we're starting an adolescent clinic, and that's its own little culture as well, the teenagers. So some of you in the introductions mentioned your own families. I have 4 teenage boys of my own, and so as they have all entered into the teen years and I have their friends around the house and things like that, they almost speak their own little language as well, and they always have fun helping me understand what they're saying. But that is its own culture as well. And so not only with families of origin, maybe cultural medical practices. Another example, we have some Muslim families, and they prefer for their female children, they want female physicians, and we're able to accommodate that, versus a male physician. That's just what they're more comfortable with culturally. And so we pay attention to all of those things. The other thing I wanted to mention, which again is not necessarily an obvious thing, but on the more business side of things, we do pay attention to our empanelment as well. So we look to see how many patients are attributed to each of our clinicians and make sure that we're not getting too high, because while we want to see everybody who wants to see us, if we go way over that, then we aren't able to serve our patients appropriately. They won't be able to get in, getting back to that access and all of that. And then finally, I wanted to give you a couple examples of some of the programs that we do and have participated in. So Comagine actually was one of those as a partnership with our Cora Foundation in Mouth Matters. So we provide some dental care and put fluoride varnish on for eligible families in our pediatric clinic. So that's not to take the place of the dentist, but just as an adjunct there. Multicare has a partnership with the YMCA. There's certain eligibilities where families can actually get several months of free membership. We provide grocery coupons for fruits and vegetables for eligible families so that they can try to provide nutrient-rich foods for their families. We partner with our social workers, and if families have problems with transportation. The collaborative care model I mentioned already. Many of our clinics, again, we're working with Reach Out and Read to get all of our clinics online with that, but we provide books for the younger ages, so that promotes literacy in the home. And then, of course, we're all about vaccinations. So we provide that not only at our well child visits, but also at any other visit. And then Maricruz has a mobile IMS service as well that's going to be folding underneath primary care so that we can go out to the community and provide that as well. So that is what we do in a very, very small nutshell there. You can just flip through the next slides, just a couple of pictures of some of our patients. And thank you very much for this opportunity and this time.
Thank you so much. I just had a question for you as you were speaking. You were highlighting creating an adolescent clinic. And adolescents are such a unique population where some people are like, they're kids, some are like, they're adults, and they're uniquely themselves. And they have unique needs. Could you talk a little bit about the desire and interest to create an adolescent-specific clinic and the goals of that?
Yes, absolutely. Thank you. So there's actually a whole fellowship. So that's 3 additional years of training beyond the general pediatrics training that I mentioned for adolescent medicine. And so that's what we're looking to bring on there. So our model will be primary care. Some models are more specialty care, but our model will be primary care because, again, we felt that that reflected more that whole person care. So many of our teens have higher needs for mental health. They may have reproductive health concerns. They may want to get, again, kind of one-stop shopping for the various contraceptive options. We do offer some in our primary care clinics already, but some of the procedurally related things we don't offer in our primary care clinics right now. And then also an environment that they feel welcome in. So most of our pediatrics clinics, because the bulk of our patients still are under that teen age group, the teens have fun with it. Sometimes they like to get their stickers too and, climb up on an exam table that might look like a fire truck or things like that. But they also very much appreciate that more like I am becoming a young adult and that more mature environment to be in. And people who as they say, get them. So that was our desire and our goal is to provide a place where people are very comfortable with kind of that next level of behavioral health needs, that next level of teen-related concerns.
Thank you so much. I really appreciate you sharing that. And that kind of leads us to a good transition to our next speaker, Maricruz Sanchez from WithinReach. So you've already heard in our presentations from a health plan perspective, a primary care perspective, and we really want to go into the community here from like a nonprofit of how their work is intertwining to support whole person care. So I'll pass it to Maricruz.
Thank you so much, Emily. Hi, everybody. Really great to be with you today. My name is Maricruz Sanchez. I use she, her pronouns, and I'm the interim director for the coordinated access team at WithinReach. In my role, I have the privilege of working with a really amazing team of really passionate and dedicated staff who work on the front lines to support individuals and families throughout our state to help them get connected to really critical community supports and resources. I'm excited to be here with you all to talk about whole person health and some of the really wonderful work that WithinReach is doing to support young people in our community. Next slide, please. For those of you who may not be familiar with our work already, WithinReach is a nonprofit organization that specializes in connecting families in Washington State to health and community resources. In addition to being resource connectors, we are also advocates, uplifting the experiences of the families that we serve every day by working with policymakers and partners to realize lasting change that will improve our community health and social service systems in the longer term. Our work launched at this point over 35 years ago, and we began as a maternal and child health focused agency. Formerly, we were known as Healthy Mothers, Healthy Babies. And we recognized how difficult it was to navigate our health and social service systems, particularly for pregnant people and newborns in our state, and how barriers to access were really keeping people from critical health impacting supports in those very important stages of their lives. Since then, we've been working hard to make sure that the process of getting connected to basic needs and health resources is easy, or in the very least, easier. And before I dive deeper into how it is that we connect families to services and the type of support that we provide, I want to talk about the close relationship between Help Me Grow Washington and WithinReach. Next slide, please. One of the principal ways WithinReach is supporting whole person health for young people in our state is through our role as the statewide coordinated access point for Help Me Grow Washington. For folks who may not be familiar with Help Me Grow Washington is a growing system of supports that's made up of state and local partnerships. It aims to create a connected network of services so that Washington families can easily access the resources and the services that they need to be healthy in a one-stop shop type of model. Help Me Grow champions, among a lot of things, developmental screening, early detection of development or behavioral concerns, as well as linkages to services to support healthy development of all young children. The overall goal of a Help Me Grow system is to link families to community-based resources and to empower them to support their child's healthy development. Within the Help Me Grow system, a coordinated access point serves as that go-to place. We serve community directly, as well as family members of children, child healthcare providers, and a whole range of other professionals who are working with families and are seeking information, support, and referrals for children. In addition to a statewide cap, it's important for me to highlight that there's also a growing number of regions in our state that operate a more localized coordinated access point to serve families within their respective regions as part of Help Me Grow. In regions where there are local coordinated access points established, there's a close relationship and partnership that's happening between those local CAPs and WithinReach's statewide CAP, with the goal of making sure we're maximizing opportunities for resource connection for families in those regions. For today's purposes, I'll primarily be speaking to the work of WithinReach through that statewide coordinated access point. Next slide, please. Before I go over the core service areas in which we specialize providing resource connection, I want to share what I feel are some of the really distinctive features of our coordinated access point, which illustrate both our commitment to whole person care and delivering exceptional, accessible services to families. First is our comprehensive screening for benefits and resource eligibility. Every person who comes through our coordinated access point is offered a comprehensive screening for programs and services. Our goal is to maximize connection to supports as much as possible. And so our intake process is built to give our staff a strong understanding of a family's circumstances when they're coming into contact with us, as well as their areas of need. To do this, we have a mix of demographic questions as well as social needs questions based on social determinants of health that help us understand what is a family likely eligible for beyond, that presenting need that they're coming through the door with. And that leads me to wraparound support. We are really dedicated to ensuring that we can provide the most service possible to a client and taking full advantage of our connection with them to assess what other programs and services they may qualify for. It's so common that folks call us with one need, and through the course of our call with them, learn about a whole wealth of other supports and services that they could be accessing in addition to what they came to us originally with. And our goal is to empower families. It's not just a matter of being enrolled in a program. Sometimes there's other barriers that come into play for people to gain access to critical supports. And so we have a deep knowledge of a few core program areas where our staff are really specialized in knowing the ins and outs and what are the common sticking points for people in navigating those systems. So we coach families to work through those supports so that they can be successful in getting access to those systems. We also really pride ourselves in being patient and supportive. We like to call ourselves an unconventional call center because we don't hold people to a specific call time. We're really here to walk side by side with the client to answer all of their questions and provide as much education and support as we can. The client is really the expert in what they need. And so we really take their lead in what they're willing to take on for that interaction. And also make sure that they're walking away with a really strong sense of what their next steps are and a game plan for connecting to services. And finally, I want to highlight our workforce. I think it's really critical that we strive to hire folks that have shared lived experience with the communities that we're aiming to serve. Many of our folks have been in a position of accessing public benefits or navigating social service systems. And so the empathy that they can relay to clients is really critical in building trust and relationship with folks so that they feel comfortable disclosing what their life circumstances are. And like the person on the other end of the line is not judging them. So much of our work is actually stigma busting and misinformation busting work. And so being able to build strong relationship and folks being able to see themselves in us is critical to our success. A lot of our folks are actually bilingual and bicultural, and can also represent a very diverse community across Washington State. But for places where we can't offer direct language support on staff, we have access to telephone interpreters. At the top of the slide, you'll see the two principal ways that individuals and families, as well as providers, can connect with our statewide coordinated access point. First is our Help Me Grow Washington hotline. That's the toll-free number you see at the top of the page. It has pretty traditional business hours. We're available Monday through Thursday from 8 a.m. to 5:30 p.m. and Fridays from 8 to 5. And one quick call to that gets you in touch with our resource navigators. And from there, they'll begin that interaction to assess what you're interested in and provide connection to services. I'll say that our goal is not always, to get you out the door with something in hand. We start wherever you are. And so if it's a matter of just having curiosity or questions, we're here to be that support of information and education, and all the way through potentially help with enrollment in benefit programs and services, just based on kind of your capacity and interests during that call. I also want to highlight the other way to get in touch with us is through our Help Me Grow Washington website. So that's helpmegrowwa.org. And the advantage there is that that's available around the clock. The website is available in multiple languages. So in addition to English, it's translatable to Spanish, Russian, Vietnamese, Somali, and Amharic. And it gives a really great overview for folks who may just be wanting to get studied up on who Help Me Grow is before making that call. How do we serve the community? What services can we provide? There's also really good foundational information on different public benefit services or common resources that we get questions about. And I really want to emphasize that this is a landing place, not just for community, but also providers and professionals who are interested in maybe connecting their clients with our services. The website itself has a couple of key features that I want to highlight. One is access to our public-facing resource finder. So if you're interested in navigating resource options for your local community independently, there's an easy way to navigate to that, and it provides information and resources on our core service areas, which I'll talk about in just a minute. The other is that there's access to an online referral form. And so one is actually specialized for folks interested in service for themselves. We call that our self-referral form. It's a really basic questionnaire of, name, contact information, language, and what are you looking for support with? The other is a provider-based form, and that has a little bit more comprehensive questions to help us understand the situation of the patient or client that you're working with. And when you submit either of those referrals, they basically land with our contact center team. So a resource navigator will follow up with you within a couple of business days to provide essentially that same type of wraparound support and service. The advantage and nice aspect of that is when you can kind of request a call to you as opposed to having to wait on hold and go through that process. And there's also the advantage of giving us some information in advance so that we can actually do some of that research and thinking about resources ahead of our call with you. Next slide, please. I'd like to end with a brief overview of the core areas in which we specialize. And these are recognized as what we call essential services through Help Me Grow Washington that we believe are critical to promoting health and well-being for children and their families. So hopefully some of these programs and logos look familiar to you. So much of what we do is public benefit access and helping people know whether they qualify, or even helping them get enrolled in some of these programs. But everything essentially falls under these four large umbrellas. So firstly is medical care. This can look like helping people navigate and enroll in affordable health care coverage. We are navigators for the Washington Health Benefit Exchange. We also help people navigate free and low-cost community health resources. That can look like immunization clinics or looking for a place where they can use their Medicaid to receive services. It may also just be education about what benefits does my coverage offer. A lot of what we do is Medicaid focused, but we work with folks who may be sliding scale or looking at low-cost healthcare options as well. Food security is next, and that can look like screening and application assistance for key nutrition benefit programs. That includes WIC, or the Women, Infants, and Children program, as well as SNAP. We have a partnership with DSHS to assist people through the full application process through Washington Connection, and that is actually a really large part of what we do. We also provide information and education on supplemental nutrition resources. So sometimes when you're on SNAP or basic food, as folks may know it, you qualify for a lot of auxiliary programs or seasonal benefit programs. Things like I heard earlier the mention of Complete Eats or farmers market nutrition. And so it can be a huge help to just educate folks about those extra services and resources. Next is child development support, and that can look like linkages to tools and services that promote early monitoring, screening, and detection. Some of the tools include things like the Ages and Stages questionnaire. We help folks get enrolled in our statewide Watch Me Grow system, which provide materials on age-specific information about like well-child visits, growth and development, vaccine schedules, all kind of specific to a child's age from 0 to 6. And we are also ambassadors for the Learn the Science Act Early program, which promotes developmental monitoring. And finally, but not least, is family stability supports. And this really covers a broad scope of additional resources. It's kind of everything under the sun that we don't necessarily provide as much direct hands-on support for. It can look like transportation assistance, helping people understand what reduced fare bus options are available in the area. What does Medicaid transportation look like? So helping to understand what options for transportation may be in their region. Baby supplies is a big one. We get a lot of questions, especially from new parents or expecting folks about how they can get ready for their baby, or basic things like diapers, which can be so incredibly expensive, or formula. We also provide information on things like clothing banks. More and more, we're building deeper partnerships with the Employment Security Department and folks like Child Care Aware of Washington, so that we can have a seamless connection to those sort of clearinghouses of services to connect people to childcare resources and information about how to access paid leave when they have a qualifying life event. I'm sure I've taken up more than my lot of time. This brings me to the end of my presentation. Thank you so much again, Emily, and everyone, for the opportunity to share about our work.
Thank you so much. I really enjoyed hearing you speak and talking about stigma and myth busting work. I was hoping you could just talk a little bit more about how your unconventional call center is working on the stigma and myth busting work to build more holistic relationships with your clients.
Yeah, it's interesting because I think that's such a good question. We hear often clients come with assumptions about what programs and services they may qualify for. It's amazing in low-income communities, and I'd say especially in immigrant communities, there's a lot of learning that happens through word of mouth, and those are trusted networks of information for people. And unfortunately, some of that information may not be accurate, or there's things like, I think public charge is a really great example, where folks may believe falsely that they're not eligible for programs or services because there's a fear tied to potentially accessing a program that they're not actually supposed to be qualified for, and the consequences that can come to themselves or to their family. And so we do a lot of education around what are talking points we can use with people to sort of correct some of that misinformation that happens in community. And also just being open to listening. If someone says, actually, I already tried to sign up for a basic food and that didn't work out. Okay, can you tell me more about that? Because, and often that opens up a conversation about, well, it looks like you're qualifying and that was maybe a different situation in the past, or let's check again to see if you're eligible now. So it's coaching around kind of that motivational approach to conversations, and being really tuned in to listen in for some of those cues.
Thank you. Appreciate that. We will now welcome our speakers back on, our other fellow speakers, and kind of open it up for a Q&A. Again, if you have any questions, place it into the Q&A box and we'll work on asking them to our speakers. But as we wait for some questions to come in, there's a couple lines from each of you that came up as you were speaking that stood out to me. I heard kind of working backwards, Maricruz was like word of mouth, and how that's really can be a really trusted relationship in our community, both in a positive way, but also potentially harmful when you don't know where the knowledge is coming from. I appreciated Dr. Donalty, you're talking about how are we building an environment where people feel welcome? And I feel like that kind of goes with that word of mouth where if people are positively speaking about you, then you might get more energy coming your way. If it's negative, it can be really hard. And Libby, you really highlighted an issue that I think all of us have been experiencing is there is a need of services for people and they're not able to get them. So I'm kind of curious, how do you foresee that we could all work together between a health plan, a delivery system, the community, others who are not on the call today, like employers speaking, how are we all collaboratively working together to support our collective patient or client?
Yeah, I think that's the crux of everything. It's like all of the system partners have to work together. So it has to be driven originally by the community in many ways. So the community identifies that something is going on, looking at the resources within the community, working with the partners within the community. Is it expansion that's needed? Is it looking at different services, gaps in care, those kinds of things, and working with all the system partners. I think a really good, just brief example of this that I've seen is around access for children with autism. It's been a real challenge in Washington State, and particularly that group has really struggled, those youth and the families in getting support. And it crosses over many systems of care and many different folks that are providing those services, primary care, behavioral health services, as well as ABA providers or Department of Disabilities Administration, all of those. So really coming together and looking at solutions. And some of those are through those integrated care discussions that we had, really building within primary care the opportunity to support children with neurodiverse backgrounds who really need those additional supports. So bringing ABA services or occupational therapy in, or speech language pathology, those kinds of things. So yeah, it's very complex, and it takes everybody to come together and really say, how do we address this? And what is the best way to do that?
I would add too, for us all, as we have awareness of each other and the services that we provide. So Libby, when I was listening to you talk and you were talking about some of the value-based arrangements, right? So when we've got Molina patients and we participate in those, that shows us also what you all are focusing on and what you would like us to do. Maricruz, as I listened to you talk, right, we refer patients to WIC. We utilize 211 sometimes as kind of that clearinghouse to get plugged into, all the various services. But sometimes we're the ones that hear about, like, gosh, I can't put food on the table all the time, or, it's really a struggle to get diapers or formula, or, whatever the case may be. That's younger kids now, but, certainly there's needs for older children as well. And if we know about you all and you know about us, right, that's one of the first steps also to be able to further that information and get people into the right resources.
Yeah, I love that. I fully agree. I think having awareness of each other, knowing each other's strengths and wheelhouse is so critical. And again, coming back to that relationship piece, as we know each other deeper, like, it goes such a long way to do a warm handoff with somebody as opposed to a cold. Here's a number, give them a call. And that little encouragement can make the difference between somebody getting connected or not. So leaning into those relationships feels really critical.
I think something that's kind of unique about this population is that involves parents or a caregiver, a loved one, in a different way than an adult may have. So supporting caregivers is essential for this population's health and really sustaining whole person care. How do you work to build the capacity of parents and caregivers to navigate the healthcare system and access services their children may need in the community? How are we bringing in their and building self-efficacy also with the parents or caregivers?
I think Dr. Donalty said it really well, that, children are not in isolation, right? They're within family systems, they're within families, caregivers, multiple people. So really looking at how do we really design and really support our services with families in mind, wrapping around the entire family. I think View is a really good example of that, of how it really works with the child, as well as any of the caregivers and folks that are involved, schools and all of those kinds of things, to really help support the family. So absolutely crucial.
Yeah, and sometimes I've observed it can even start with the smallest thing. So I do like to often illustrate my points with anecdotal stories. I had a family in my office the other day who suffered a house fire a number of months ago, and they've been in various transient housing situations since then. She's got some special needs kids. One of them's neurodiverse, and I've been doing this for almost 30 years now, but we surprise ourselves sometimes too, And I just said to her, I was like, you are doing a lot. You've really done a wonderful job. And just the look on her face was shocked. Like, no one's ever told me that, right? Like, nobody validated her. So in that moment, I mean, that took 10 seconds, right? I wasn't connecting her with a service. We were doing that also, don't worry. but but just that one little piece, I think gave her more, it seemed like it gave her more strength to carry on, right? And it was really just that person-to-person connection. And I was surprised too of like how much that did for her. So yes, the connections, yes, getting people to services, but sometimes it's even the littlest things that we don't know are making a difference for people.
Yeah, I just add that our approach is to do a full assessment of the household, right? And so we're trying to understand who is providing care, because it isn't always a traditional household. What are their needs? There's a lot of parent support resources that we offer, including things like home visiting supports that may be really beneficial to people. And coming back to, again, what you said, Dr. Donalty, is we thank people for calling us, and we always say, yeah, that encouragement of, you're doing so much for the well-being of your family right now. I hope like you're really recognizing the impact that you're making, or how you're going above and beyond to support the wellness of your child. And that is also, it's kind of two-pronged, one to help people see the strength in themselves. But again, we constantly have to battle this hesitation to ask for help. Folks often feel like, in our world of connecting to benefits and services, very shy to ask for support sometimes, because they think they're taking from somebody else, or that there's a limit to how many services are available. So yeah, working in that gratitude and encouragement has been key.
Well, as we work to kind of wrap up today's event, I just really appreciate our speakers for the themes that kind of came up as we were highlighting at the end with the facility, the Q&A, is the importance of knowing each other's strengths. And I think both in understanding the parent, caregiver, child, youth's strengths, and how do we highlight those and acknowledge them? Because I think so often in our life, it's what can we do better? What more can we do, rather than you're doing a lot and you're doing great, but also understanding one another's strengths. Is it's okay to have a weakness, but there's somebody else in our group, in our healthcare ecosystem, that can overlay what you may feel as an area that is not as strong, and refer to them or connect with them, and the significance of knowing each other. And so you can have more of those warmer handoffs, rather than here's a piece of paper, call them, or I think over here, and really be like, oh, like do you know WithinReach? Like Maricruz and her team's great. Or like, oh, you know what? You're having an issue with your health plan? Let's call them. I know some people there that are great. And also with your primary care center. So I really appreciate you highlighting, all our speakers highlighting the importance of knowing one another's strengths, and utilizing that to then uplift and work for our collective Washingtonian patient. We want to thank everybody for joining with us today. We have quite a few events coming up within the Bree Collaborative space that we want to invite you all to join. A handful of them are also really focused on this population of youth behavioral health. and kind of doing more of a deep dive into different interventions and skills and resources. So we invite you to join us with those. I will send them out via email to all of you so you have access to sign up, and we'll be putting them in the chat here momentarily if you'd like to click on some of those links. But I really want to thank everybody for joining us, but especially our speakers for sharing their time, knowledge, and expertise with us. We really enjoyed the opportunity to learn from you. We hope everybody has a wonderful day. We hope to see you at a future event. Thanks, everyone.